In fact, we'd like to show people, we have graphs to show people about what's happening in the air in Montgomery County, what we've collected over the years. And as a matter of fact, the very interesting statistic is that the American Lung Association's report for 2003, which was the most recent we could get, gave Montgomery County an F for air pollution. And that was in regards to
for unhealthy air,
for hazardous air pollutants. Montgomery County happens to be number 2 in the whole state of counties as far as the hazardous air pollutants that are emitted into it. And the most awful part of that, Nick, is that the most carcinogenic, these are carcinogenic air emissions. The most awful part is the most carcinogenic and damaging air pollution is not even counted in that data that's self-reported to EPA in the toxic release inventory, such as the radiation, the routine radiation emissions into the air from Limerick nuclear power plant. Undeniable, they're there, but they're not added into that data. Also not added into the data is the radiation and the dioxin byproducts that are being emitted to this day from Pottstown landfill. Into that data doesn't include Pottstown landfill's violations of volatile organic compounds to this day that are going on. So, I mean, there are lots and lots of air pollution threats that are not even calculated or monitored or considered.
When a municipality makes a decision to put in a facility like that, they don't have to take into account regional planning then, do they? In other words, they can make that decision because that property is within the boundaries of their municipality. And they don't have to consider any regional effect on it? Is that what you're saying?
That is correct.
That's right.
And neither does DEP. As a matter of fact, you know, let's just take another problem. It's not only people that live around the Pottstown landfill, but because of us pressing these air pollution issues, it was discovered that their TCE emitters in Collegeville are two of the highest emitters of TCE in the nation. Well, look out. Because if this trash-to-ethanol plant gets put in, those people are only a short distance downwind, and they're already dealing with these enormous TCE emissions. And DEP doesn't, for example, DEP could say, okay, there's way too much TCE in the air, people have been exposed to it for decades, we need to get these facilities to transition to the safest alternatives to TCE.
Right.
Because they're actually violating health-based standards of the Clean Air Act, as is Pottstown landfill. Pottstown landfill is violating to this day, and will probably for a long time, be violating health-based standards of Clean Air Act. That air pollution is going right into the Limerick nuclear power plant steam, which travels on downwind right into the TCE area.
So these things are all relatively in line downwind.
Right.
So we have the
That's
Pottstown landfill, the nuclear, and we had Occidental, right?
Occidental
Right.
was also
Occidental was in that stream.
Was
Also in that corridor.
stream.
The power plant, nuclear power plant, now the potential for an ethanol, trash-to-ethanol
And this
plant.
trash-to-ethanol plant is just over a mile from Limerick nuclear power plant.
Okay.
So whatever's put into the air is just going to mix with that.
So that's why you
steam
use these words: additive,
Right.
cumulative,
And
and synergistic. Those
Right.
are powerful
You
words
bet.
that people need to understand what that means. Additive means something's already there,
Right.
and you're making an addition to it.
Right.
Absolutely.
Right.
And cumulative means over time.
Over time, it's accumulating.
And
let's
the
say.
synergistic impact is that people don't breathe. You know, when DEP gives their permits out, if they permit this facility, which they will, all the trash-to-ethanol plant has to do is ask,
Right.
and DEP will just permits on demand. That's them, and so they'll just give a permit for one pollutant at a time, as though that's all.
That's all we breathe.
That they breathe.
You only breathe one molecule of air at a
That's it.
time.
From that
That's right.
facility.
Right.
You know, I mean, the whole DEP pollution permitting process is based on illusion.
Well, it's broken.
It has nothing to do with reality. Even the standards they use are outdated, old, have nothing to do with what really happens to people's bodies from what they breathe and what they're exposed to.
And who has the power to change those outmoded rules of DEP? I know we want to talk about other things, Lou, but I want to make sure we get this issue out. This is
elected
important.
officials.
Elected
Basically,
officials.
it's a state agency, so it's a matter of direction from the leadership at the state. Starts with the governor.
The governor.
And it flows to the Secretary of DEP, and it's heavily dependent on the legislature. Pennsylvania reps and Pennsylvania senators. They're the people who give DEP their marching orders.
So are they in denial of the information that you guys have, or is it they're just not choosing not to deal with it? Or are they ignorant of it as well as the?
I would say we're very fortunate right now that we've got a state senator that truly understands that has taken time to look at the reality, to look at the facts, to look at the research, and understands that what's put into our air makes people sick, and especially children. That these things are far more impacting to children. That's the really pathetic part. DEP's regulations are based on adults, healthy adults.
It's John Rafferty you're referring to.
Right.
Senator John Rafferty has been out front on all of these issues, Nick. And to connect it to your previous question, it's going to be a matter of time, which is very frustrating for people in the medical profession and people who are doing what I call real science as opposed to science for sale, as we've talked about in some other programs. People who are really doing good science and putting the evidence out there are frustrated by how slow the process has been over the past couple decades in terms of changing regulations, affecting public policy. I compare this to the analogy of, at the federal level, dealing with global warming. I mean, how long has it taken us as a country to acknowledge, accept, and move toward doing something about global warming? I mean, this last administration has spent 7 years trying to tell people that global warming doesn't even exist and stripping out regulations. Obviously, we can do better than that. It might sound trite to some viewers, but we need change in this country at the federal level and at the state level in terms of protecting our environment and protecting residents.
And if you want to know why it doesn't happen because, for example, just this Limerick project that we're talking about right now, you've got Limerick supervisor and real estate developer David Kane claiming that that Limerick supervisors are going to listen to the experts at DEP. Well, I'm sorry, but if they're going to listen to what DEP has to say and not look at the reality of what's going to happen here, then Limerick residents are going to be poisoned. This is all because DEP's decisions are, while they should be public health decisions, they have nothing to do with public health. So the reality is, if you expect protection from DEP, you won't get it.
So they don't have a history of denying permits. Basically, if you,
I've
understood in the past.
We have not known them to deny one permit since we've been involved in this.
For this region.
One permit to pollute after the other, in spite of violations of the health-based standards of the Clean Air Act, in spite of, for example, the eastern expansion of the Pottstown landfill should have never been polluted.
Should have never been
Permitted,
Well, it shouldn't have been polluted either.
Shouldn't have been polluted either.
Right, exactly.
But it should have never been permitted because Pottstown landfill was already putting out more than their limit for the health-based standards of the Clean Air Act. But they just went ahead and ignored. DEP issues pollution permits. That's what they do. Their job, they issue pollution permits and they collect fees for that. That's what they do.
So is there logic in your opinion that they justify an amount of release rather than the denial of that release? They say, well, this is a safe level, therefore we can let it go through.
Well, if you want to know how this is going to work, let's use this project for an example.
Right.
The people who are trying to do the trash-to-ethanol plant are going to make up their own permit. And they're going to say, this is how much VOCs we're going to release. This is how much particulate matter we're going to release.
They'll estimate or guesstimate, as we've seen this in other cases.
And the fact of the matter is, Nick, even corn ethanol plants throughout our nation have shown that they have far underestimated the air pollution and the reality after these plants have been put up. As a matter of fact, EPA had to sue them and won a settlement for $485 million over the air pollution violations from these ethanol plants that have already been put out there. So they pollute the air. There is no question about that. People already living around corn ethanol plants are getting ill health. They're reporting ill health all the way around the board. And even after EPA made, so when Limerick supervisors or somebody else tell you that these are going to have pollution controls on there, don't believe it's going to make much of a difference, because even after they use some of these fines to put on pollution controls at corn ethanol plants, the people were still getting sick, and it didn't make much of a difference. So,
well, in this case, corn is one thing that seems relatively innocuous as a source for
but it's
ethanol,
bad enough,
and it's bad enough. But now we're talking about trash here,
which would be much worse,
which has everything in it.
Absolutely,
everything.
When we talk about the effects of air pollution on people, sometimes that just kind of sails right past most people's frontal lobes, and they don't even think about it.
Right.
I want to just reinforce a couple of pieces of information for our viewers, Nick, because it startled us when the information became available, and it hasn't mitigated yet. And unless we eliminate this particular proposal and any similar proposal, we're not likely to see these numbers going back down in the near future. Montgomery County, which is right in the middle of this picture, as Donna mentioned, according to the American Lung Association, received a grade of F, for air quality. We ranked number 2 out of 67 counties in the state. So obviously, there's some really bad things happening in Montgomery County. But I want to share some statistics that we've shown in previous programs, because I think it bears revisiting this to focus people on this. Montgomery County statistics have just been abominable.
Since Limerick Nuclear Power Plant went online.
Right. Since
the increases.
That's correct.
Unbelievable. From
the mid-'80s to the mid-'90s, the comparative statistical data from Pennsylvania State Cancer Registry, okay? This is legitimate, documented, verified information. I'm going to rely on these guys. I'm not going to listen to anybody who works at DEP and consider them an expert compared to lots of other sources. But if people choose to do that, they do so at their own peril. But according to the Pennsylvania State Cancer Registry, Nick, from the mid-'80s to the mid-'90s, the largest increases in newly diagnosed cases occurred in the following areas. This is in Montgomery County. From the 80s to the 90s, prostate cancer increased over 100%. 132% increase. I don't know about you, but that startled me the first time I saw that number. Shocking. Absolutely shocking. Thyroid cancer, known to be related to some kinds of things that have happened in this region. To radiation. Increased during that same decade, Nick, 128%. 128%. That's just gigantic. Shocking. Kidney cancer in Montgomery County from the 80s to the 90s increased 96%. This isn't happening other places. This is happening and has happened right here.
There are increases in cancer all over the nation.
All over the country, admitted.
But these kinds of increases aren't happening in other
places. They're startling.
Yeah.
Startling,
yeah.
Yes.
Let me just go through the rest of this list, because I think it'll illustrate the point. Multiple myeloma, 91% increase during that decade. Hodgkin's, 67%. Non-Hodgkin's lymphoma, 61%. Breast cancer, a major epidemic nationwide, much worse here than in most places in the country, including many major urban centers, 61%.
Wow.
Pancreatic cancer, 54%. Leukemia, 48%. And there were lots of other kinds of cancers that followed that list. But that list, Nick, from the 80s to the 90s, absolutely documented and verified the major health crisis that this region has had to deal with during that time. And our point is, we need to reverse the trend, and that's not going to happen if we have.
If we're going to add in another thing.
If we have local officials in any municipality.
And you can't deny when you're having all these carcinogens put into the air. When DEP finally did the testing, they found 16 carcinogens at the Pottstown High School in the air monitor, the same ones that are coming out of Pottstown landfill. Do we think that Pottstown landfill blowing into that thing 1.9 miles away isn't a major source of that? And all that goes down, and where's it going? Right into the radiation that also causes cancer, that goes right down into the TCE that also causes cancer. So, I mean, to deny that this air pollution is not a major factor is the only cause? No. But is a major factor? Absolutely. So cannot be otherwise.
The Limerick commissioners or whatever, supervisors there, well, not, they say that it's not your